Maybe we'll get started. And since it's a small group, feel free to, jump in with questions. We can make it a little bit more collaborative. I don't want to just lecture at folks. And get to know each other a bit. But basically, I'll introduce myself first. I'm Vinay, he, him pronouns. I'm the national field organizer with the Center for Popular Democracy. I'm not sure if y'all have heard of us, but we do a lot of work with healthcare now, pushing for Medicare for all. We also do a lot of work combating the overdose epidemic, trying to lower prescription drug prices. Of course, lots of work throughout the COVID era, trying to keep people safe in a lot of different ways. And the organization is a national network. We also do immigrants' rights work, labor organizing, climate justice. And yes, good. We did not script that, but thank you, James. We had a big Climate Earth Day event yesterday in DC. There's a lot of folks from CPD there, a lot of my colleagues. Glad you can make it out, James. I saw some pictures and videos online. It looks really fun. And one more person just joined, so let's just say hi to Carol before we dive in. Hi, Carol. We're just getting started with some introductions. If you wanted to put your name in the chat, thank you for joining. So I was just saying, I work in all of our healthcare campaigns at CPD. And one of the big things we started a couple of years ago was called Birddog Nation, which is really a project about bird dogging. And I guess that's why you all are here, to talk about bird dogging, particularly around healthcare, particularly around Medicare for all. So the short version of all that is that bird dogging is basically, the skills you use to go talk to a legislator at a town hall or at their office or other kind of venue. And basically you're asking a question about, your issues, which, healthcare issues is why we're all here today. Then you're asking them, like, on their record, will you support Medicare for all, or will you pass a certain bill? Will you expand the ACA, whatever it is. So it's just the skills you use to do that sort of thing, to make you comfortable going to a town hall or asking your representative a question. So hopefully at the end of this presentation, you'll all feel comfortable doing that. So I'll just give a little bit more background on Birddog Nation, and then I'll open the PowerPoint and we'll go through some slides on the best ways of bird dogging. We'll hear some bird dog stories. And then at the end, if you want to, we can do a little role play where all of you try to bird dog me. Some folks love doing that sort of thing. Other folks, less comfortable. So we can see how you all feel at the end of the session. But yeah, so just one more story I'll tell before I dive into the PowerPoint is that at CPD bird dogging, we really started doing it on a mass scale in 2017, which, if you remember, is when Republicans and Trump tried to repeal the Affordable Care Act. And we organized lots of people with disabilities, lots of people with all sorts of illnesses, folks directly impacted by our healthcare system in a lot of ways. And so we were like, okay, we're going to do everything we can to save the ACA. So we flooded town halls across the country and confronted Republican senators. And it's basically people with disabilities, people with illnesses, telling their personal healthcare stories and asking them and pressuring them to support the ACA. And then all of us went down to DC, and we did civil disobedience in Senate offices, telling our healthcare stories, refusing to leave. A bunch of us got arrested. I got arrested a couple of times. And that was kind of the birth of Birddog Nation. It was CPD and our partners at Housing Works at New York, which is another great organization. And so, yeah, that was my first. I was just a volunteer at the time. I didn't have a job. I just went down, got in a bus, told my healthcare story, did a lot of bird dogging, got arrested. And basically, I just kept going back until they hired me. So I guess bird dogging is good for career development also. But yeah, that's how this all started. Any questions about any of that before we kind of dive into the actual presentation? Oh, it looks like Madi can't hear me. Can everyone else hear me? Jim, can you hear me? I see your face. Okay, I think other folks can, Madi, so it might be your audio if you want to take a minute to try to fix it. Yeah, I see some thumbs up from other folks, so take a minute to fix that if you can. All right, I will share my screen. And excuse my messy laptop. Okay, Jim, I can still see you. You can see my slides? Thumbs up. Cool. Thank you. All right, so this is Birddog Nation. It's a nice little graphic of us. And so what is bird dogging and what is Birddog Nation? I talked a bit about I talked a bit about both, I guess. But I guess I'll open it up to the crowd here if anyone else has bird dogged yourselves or any kind of anecdotes or stories y'all want to tell. Are folks here familiar with bird dogging already a bit? See some thumbs up, some nods. Great. Well, we talked about it already, and I'll try not to read text from a slide after this slide, but I will read this one. The rest we can be more informal. But bird dogging is the art and science of putting our elected officials or candidates on the spot, in person, in public, and on camera so they do the right thing. Birddoggers focus directly on the person with the power to give us what we want at a moment of easy access and when they are looking for our support. That second part is really important. We're focusing on the people with the power to give us what we want. So often it is a Congress member or a senator, but it could also be the executive of a bank or a museum or a corporation or your local city council member, or pretty much anyone who has decision-making over what you want is who we're targeting here. And the goals of bird dogging, why would anyone do this? Like, what's the point of all this? Is we think we can create movement on our issues. And if we do bird dogging in a strategic way and ask the right questions in a strategic way, and we'll talk today about, what the right questions are, we can create movement on our issues. And you saw that with my first example, right? When I talked about the ACA. If you remember at the time, pretty much no one thought the Affordable Care Act would survive the Trump era. And particularly that year, people told us, you're wasting your time. Like these are very powerful actions, but there's no way, Republicans are going to vote to protect this. And, after day of civil disobedience and telling our stories, we did get Collins, Murkowski, and McCain to support the ACA. So we're thinking like that's our first time doing this, and we replicated it for all sorts of fights, but it's evidence right there that, you can win at the highest levels. And I'll tell a couple of stories later on about other, ways we've used bird dogging tactically to win. But as we do that, one way to think about all this is each time you ask a question at a town hall, you're all putting little stones on a scale, this is how we think about it. So like a lot of people ask me, like asking one question at a town hall is not going to, save the country or get a bill passed. So like, what's the point of doing this? And that's probably true. But, there's like 7, 8 of us in this room right now. So that's 7, 8 stones you can each put on a scale in a town hall. And if you get a crew of 5, 6 of your friends together, go to a town hall together, that's like 5 little stones you can put on a scale. And it's just like a visual metaphor we like to keep in our mind to, motivate us that we're all doing this together. And if we put enough stones on the scale, we like have in the past, and we'll continue to, move legislation or convince a Congress member or move voters, whatever it is we're trying to do. So just keep that image in the back of your mind. Hey, Mike. Thanks for joining. What is next? Okay, so this time I will ask for folks to come on audio and answer this question if you're comfortable. Why might you not want to do this? Everything I just described, like going to a town hall, talking about healthcare with your Congress member or senator, any like hesitancy, anybody feel like I don't really want to have that conversation? Any reasons you might not want to? And if you all want to, that's great, but I can tell you the common answers I get if you don't want to jump in. I see a hand from Henry. Henry, do you want to? I think you should have power to speak if you want to answer.
Yes, good afternoon. I'll change my name. This is Octavia. It's not necessarily a hesitancy, but there is a bit of disenchantment. I'm in the state of Georgia, and we know the suppression that goes on here surrounding healthcare. Our governor does not want to expand healthcare, doesn't want to expand Medicaid, let alone support healthcare for all. And a lot of times we find that our representatives gatekeep for that while putting on the front that they're for the people. So there's disenchantment and a bit of frustration, if you will. So it's not to say that we are not, or I'm not, for myself, I'm not willing to speak to our representatives, but it is definitely some woosah and preparation of the nerves, if you will, before we go into these to our legislators to help. So I know for myself, it's getting over that hump. How do we get our legislators to work for the people that their constituents that they're supposed to be advocating for? Because the people in Georgia want Medicaid for all and healthcare for all. We want these things, but it's that friction with our legislators that creates a bit of tension. So again, it's not to say that we don't want to do the work, because we're doing the work and we're meeting with our legislators, but there is frustration. And that's to say the least, there is some frustration knowing that we are going against, I guess, adversarial energy.
Yeah, thank you. I was about to say Henry again, but you corrected me before. I forgot your name, sorry. But if you can change it on the
Octavia, I will. Thank you.
And thank you for that response. I think that's really important to speak to here, because I definitely don't want to paint some picture that, do these 10 things and you're going to win. Like I think we all know that's not the case, particularly in certain states. I mean, federally right now, like Medicare for all is not going to pass through this Congress. We know that. So like while we're pushing towards this, we're also working on lots of intermediary steps. I think, Octavia, like there will be one slide later that shows like different advocacy skills and tools that I think will be helpful for you. And hopefully just by hearing some of these stories, I think it'll help you get over that hump. So I'll keep that in the back of my mind and keep addressing that, but I want to bring in a few more folks. Robin, did you want to jump in?
Yeah, thanks. I really support what Octavia said. Those are all cautions for me. But a new one that has risen that really paralyzes me is the fear of physical harm, either in the form of a threat that's made with a weapon, or an actual weapon being discharged in my way. These may not be rational, but they certainly are real. I also have worries about being exposed on social media or somewhere where harm might come to my family or someone who knows my name and my associations. Those are new for me.
Thank you, Robin. Those are real concerns too. I think I can address some of those too. I thought I saw a third hand. Did anybody else want to jump in before I talk a bit about what Robin said?
Yeah, I just had a comment. I totally support what these folks are saying. Fortunately, I don't have family I need to be too worried about. But the other thing that I really noticed is since activists have started bird dogging, the people who are running the meetings are very careful about who gets to express themselves. And basically, I totally relate to being shut down and ignored, where you have to submit your questions on a card or whatever, and we have no control over whether anything gets addressed or not.
Yes, that's definitely happens lots of times, and we're going to show you in a future slide coming up soon, like different creative ways you can kind of get around that, because that does happen, particularly if you're trying to target folks who don't want to talk to you. That's going to happen a lot. But yeah, we'll show you some slides that'll get over that. And Robin, I'm going to come back to what you said. I just want to make sure everyone has this chance. Carol, did you want to jump in?
Sure. So I know a legislator at the state level because I know him through the local Democratic club. And so it's someone I already know, and I want to stay on a very friendly basis with him because I have seen him get uptight if I've said I'm going to do something that is opposite, what he says, what he thinks. And I wouldn't want him to talk to the club or people in the club, in a negative way about me or about single payer in California. So, it's like how that balance of seeing him as an ally and pushing him, but not pushing him too much.
Got it. Yeah, that's an interesting concern. So I think hearing Carol, Robin, and Octavia, I think the next slide will help answer these questions. But before I go to the next slide and address what y'all said, it's funny, none of you said the thing that most people say pretty much every time I do this presentation. Although the first person kind of got to it in terms of the hesitancy and getting over the hump. So that might say a lot about all of you, because I think that just means y'all are really like down to throw down on these issues. But lots of people usually say, they don't feel like they're an expert on like a particular bill or on the law if they're not a lawyer. It's like, why are they talking to a senator or a congress member? They just feel like that's usually the hesitancy I get. Maybe that's not a problem for folks here, which is great. But in case it is, one thing I just always say is that everyone here is an expert on your own personal story. Like there's nothing I could go to school or read in a one pager or read in a book that's going to tell me your lived experience. And when you're bird dogging, particularly on healthcare, like all you need is that personal story. Like that's the key. When you're talking to a Congress member, you're just going to tell your personal story, talk about why you're impacted, and then make a specific ask. So everyone here already has that. So you don't need to be like a lawyer or a professional organizer or anything like that. You all have everything you need to do that work. Just want to make that clear, but maybe that wasn't a concern for y'all. But I did hear some of your concerns. I think maybe talking through this slide might help. So this is our escalating tools of like advocacy, and they escalate in terms of what they ask of you. So kind of lowest threshold thing you could do is maybe sign a petition. I'm sure all of you get emails asking for that all the time. You can write an email to your senator, congress member. Taking a little bit more effort would be to actually get on a call, have a long conversation, or go to an office visit, which we're doing more and more now. We stopped for a long time throughout COVID, and even though COVID is very much still with us, a lot of offices are now open to, you can go back. Bird dogging is right in the middle, as you can see on the slide, and then above that is like protesting and civil disobedience. So I think it was Robin, sorry, it might have been Octavia, sorry if I forgot, who talked about just fearing like physical threats, violence, like confrontation. Typically the risk of that would be higher in the civil disobedience and protesting front, where like lots of us have gotten arrested, and you know, any interaction with police, like no one wants to take that lightly. We don't like ask people to do that lightly. Lots of reasons why you might not want to be interacting with police. That's usually a situation where you will like, you know, be touched, maybe be grabbed, be, you know, put into a police wagon and that kind of thing. So bird dogging usually does not involve that. It's not a protest. It's not an act of civil disobedience. You should never be arrested for bird dogging. All you're doing is speaking to your representative, right? Which is how democracy is supposed to work. Sometimes, obviously, they do shut you down and they don't want to talk to you. And we'll talk about creative ways to get to them. But in general, like, I can't think of anyone that I know off the top of my head who has been physically harmed doing bird dogging. It's supposed to be a very safe thing. You're just going to talk to your representative. Someone did mention the threat of, you know, weapons and shootings and stuff like that. I mean, unfortunately, where we're living, like that could happen, you know, going to a movie theater, going out to pretty much anywhere, right? Club, grocery store, school, church. And I think someone said that they said about themselves they were being irrational. That's definitely not irrational, unfortunately. That's a pretty rational figure these days. So it's certainly, you know, always a threat, but I don't think that should stop anyone from going to bird dog. And someone did mention being doxxed. I was doxxed myself, not during bird dogging. I was doxxed. It's a long story, but I was doing legal support for civil disobedience, and some right-wing folks put like my picture online saying I was like paying protesters, and they were all actors and all the stories were made up. And that went kind of viral, and I got like threats and stuff, and I had to leave social media for a while. So I definitely know that that is very real. Sometimes when you're bird dogging, like you can keep your face out of it. You don't have to put your name on any social media posts or tag yourself. I did some bird dogging after being doxxed, and I just like told my organization, hey, I'll hold the camera up, but just, you know, don't put my name on it. You know, let's focus on the question and the senator, that kind of thing. I don't really want to be on social media right now. So there are ways you can protect yourself when you're doing this kind of thing. There's certainly no obligation that you have to be the protagonist or have your name or face anywhere. You don't want to. We're just trying to get a question out to representatives. So I think that answered some of your questions, but please nudge me again if I forgot any of them. But another cool thing about this chart is the accessibility of it. So let's say everything I described, you know, sounds like too much for you. Well, all of these like tools are important, right, to get a campaign passed, and we're pushing all of these levers at once. And so some people will be like, yeah, sign me up for civil disobedience. I'm going to get arrested. I'm totally comfortable with that. And that's great. Those people can do that. Other folks, you know, particularly folks, if they have a record, if they don't have, you know, the proper immigration status, they might not want to be interacting with police. So they just might stay home and sign petitions, write petitions, call offices, you know, do phone banks. There's bird dogging in the middle. And these are all going to be accessible to different people for different reasons, particularly people with disabilities. So what's great about this is we need people doing all of these things. So whatever you're comfortable doing, that's what you should do. And after today's session, if you're comfortable bird dogging, that's great. But if it sounds like too much for you, you can do something else. You can phone call, you can do digital bird dogging, emails. So it's cool to just keep this chart in your head, and we need people doing all of these things. So whatever you're comfortable doing is great. So that could be another thing that gets at, some of those kind of safety fears people had. And maybe when I have this slide up, I think the next slide, it says bird dog stories. So maybe I'll tell you some bird dog stories while you look at this chart, because it's going to be helpful to see like what's going on. So one cool story was back in Iowa during the last presidential primary, which must have been 2019, maybe, the Iowa runoff. I'm forgetting the exact year, but before the last election, we sent a bunch of folks to Iowa to bird dog. I don't know if anyone's been out there during the primary season, but there are state fairs, there are like luncheons, there are barbecues, and basically the candidates go and they give like 3 speeches a day, and you can basically get to all of them in a week if you wanted to. And I told you we do a lot of work on overdose, combating the overdose epidemic. So there's this bill called the CARE Act, which is like a broad $135 billion, I think, investment in harm reduction to keep people safe as they use drugs. And we wanted people to sponsor this bill. So we said, anytime a candidate, has a Q&A session, we're gonna have people in the audience raising their hands, asking about the CARE Act. And at the start of that campaign season, no candidate knew what we were talking about. They'd never heard of the bill. But they heard from us, like asking questions like day after day after day. At the end of the campaign season in Iowa, every single Democrat had signed on to be a co-sponsor of this bill. So all those people were bird dogging in Iowa, which is the center of this chart. At the same time, I was leading some lobby visits in DC, which is like slightly below here on the chart. And we did like 2 civil disobedience actions in DC that summer about overdose. So we were pushing all those levers at the same time, and we got all of them to sign on to the bill. The bill hasn't passed because it's very, ambitious, but we've gotten like small parts of it passed in other bills. So that was a huge summer just to popularize these ideas, like people talking to us about harm reduction and overdose. And that's basically driven by bird-doggers, just people like you in this room who raised their hand and talked about overdose and asked questions. So that's one question, which to Octavia, I think, asked earlier, that might help you get over the hump in terms of like, okay, this could be worth my time. Another question, actually, yeah, I can break. Michael, did you want to ask something?
Yeah, so Gus, I want to ask this. So I mentioned about I see that there's different levels of doing escalation in terms of being an activist. See that you mentioned phone calls, off visits, petition letters, emails, civil disobedience. So I was wondering if you could also, if it's possible, if it's possible for text banking as well.
Yeah, we do that sometimes. That's really can be really effective. There's this app called Hustle. I don't know if folks have used it, and there's other apps that are similar, where like our organization can get like voter files and records where you just get a bunch of numbers from a certain like location, and you can like text like thousands of people within like an hour or so. And we've done that to drive people out to an event or drive people out to sign a petition, or it could be like, here's a number, call your Congress member, ask them to do this. So yeah, like text banking is really effective. We do it during elections, of course, to get out the vote. But yeah, that's very effective. I didn't want to, this chart doesn't like include every single skill, but it's kind of the, general areas. But yeah, that's definitely included.
Yeah, because I think like text banking during elections, it's going to be a little too late. I think it's better to do it before, during, and after elections. I think it needs to be like, it needs to be a combination, in addition to like making phone calls, office visits, doing petitions, letter emails, civil disobedience, etc. And I think they need to happen they need to happen basically in a congruent way. They need to happen, coincidentally.
Yeah, absolutely. There are lots of organizations, including mine, who at strategic times will have lots of text banks. And again, like in terms of accessibility, lots of folks maybe just aren't super comfortable hopping on a phone call, particularly if you're calling an area, you might get like some angry voters who don't want to talk to you. Like a lot of people don't want those interactions. But texting is much, people feel safe. I can do it while I'm watching TV. I can do it while I'm cooking dinner. And yeah, it's great. We definitely use that as one of our tools. So thank you for lifting that up. I think I definitely have one more story I can tell here before we move on. And this is just like, in terms of empowering folks, this is just like one individual who asked a question and changed like a whole news cycle. So not even like a group, just like one person did this. We were in New Hampshire for birddogging during the last primary on climate issues. And so one like local New Hampshire woman got to speak to now President Biden. He wasn't president at the time, he was running, and asked him about his like timeline to transition to a fully green economy, like free of fossil fuels. And she set like a certain date that she wanted him to do it by. I forgot the date right now, but President Biden reacted and said like, that's impossible. Like, you can't find me like one scientist who says like it's possible to have a green economy by that date. Like that was like the quote that went out. And so we like recorded that interaction. We put it, on Twitter. We like talked about it. We had like a press release. And the Bernie campaign saw our video. And so like overnight, the Bernie campaign found like 50 scientists who said you could definitely do that in time. And so then Bernie put out a press release with the video like the next day saying, Vice President Biden says this is impossible, but here are 50 scientists who say it is. And we totally controlled the news cycle for like a day and a half. And all of that was just like one birddogger asking a question. And it's like a local person in her community. This wasn't like someone like we flew in or anything like that. This was just like a local person just asking, a candidate a question. And we got it to like go viral and like totally control the news cycle. So like that's another example. And I'm remembering one more and then I can move on. But also same location, New Hampshire, same subject, climate. We went and we talked to Senator Warren, and our ask for her, and of course she had a very progressive campaign, but something she didn't include in her campaign was that we wanted her to hold fossil fuel companies accountable, like legally accountable, for the harm they cause to communities, particularly Black and Brown communities. Basically like asking them to, pay, not reparations, but I forgot the legal word for it. But anyway, yeah, basically paying to make people whole in those communities. So we bird-dogged her, we asked her the question, and she's very polite about it. Like a week later, we bird-dogged her and asked her again, and she kind of remembered us. And she's like, oh yeah, like, thank you. Like, I know you talked to me about that last week. Very polite again, nothing really much happened. And we talked to her about it a third time, and she sat with us, talked to us about it. She tweeted out about our conversation, and then she added it to her stump speech that night, that, she added it to her list of things she was going to do, which was holding these companies accountable. So again, that was just like 2 or 3 people talking to her over a couple of weeks. And she appreciated, the persistence, and she got back to her staff and talked about it. And they added it to their speech. So again, there's a couple of different examples on different scales, but they're all success stories. And of course, please remember the ACA success story, no one thought we could do that. So this is an effective tool in a lot of different ways. We just got to get creative about how we do it. Cool. So I think I'll go to some more slides for now. And yeah, that's what we just did. And feel free to keep, it's a small group, so feel free to keep asking questions. We don't have to wait to the end if you don't want to. These slides are kind of dry. I'm just going to go through them kind of quickly. It's basically just a beat for beat to-do list on how to bird dog, and I can send this over to the Healthcare Now folks and make sure it's distributed to everyone who signs up, so you don't have to retain it all right now. These are super basic, easy things, but just to put the thoughts in your head. Obviously you need to know where you're going. So there is a website called townhallproject.com. I should put that on the slide for next time. Townhallproject.com, where you can basically look up every public town hall, particularly before an election, that your representative or candidate, whoever it is, public speeches. You can go to that site, you can go to their websites, you can kind of figure out where they're going to talk, and you can go there. That's kind of the basic way to do it. Someone pointed out earlier that a lot of times at these town halls, you don't really get access to the candidate, you don't really get, to ask them questions. So at CPD, we have gotten pretty creative with our bird dogging for people who are comfortable doing that. Sometimes we will go to the airport, and particularly before a big vote where we know all of Congress is about to fly in, and we'll kind of figure out, well, there's only two flights coming in from Kentucky, so Chances are Mitch McConnell is going to be on one of them. So like, let's have our people be in these like terminals. And then as soon as they get off the plane, we'll just like escort them to their car and like have a camera and just like ask them questions. Obviously it's a little bit more aggressive than going to a town hall. But again, those are like fun, the actual kind of bird dogging. There are also like tunnels under the Capitol. I don't know if folks are familiar with the Capitol in DC, but there's a whole like network of tunnels that connect the House, building, the Senate building, and all the offices. When I say tunnels, I don't mean like, dark underground tunnels. I just mean like hallways underground, just simple hallways. You can just camp out there by the elevators. You see senators walking by just all day long. So sometimes we'll just like go there and wait for the folks we want to talk to and talk to them on camera. I think if folks remember during the Kavanaugh protests, my then boss, Ana Maria Archila, confronted Jeff Flake in an elevator, which got a lot of attention. I don't know if folks saw that. But she told her sexual assault story and asked him, to delay the vote on Kavanaugh, which Flake eventually did. He delayed it for a week. So there could be an FBI investigation. We've since learned, it wasn't really much of an investigation. But at the time, there was a huge victory. Just one person, two people telling their stories motivated Jeff Flake to do that. So that's just the location. So think creatively, like if you can just go and talk to your representative at a town hall, that's great. If you can't, if you can find them, at a public speech or a barbecue, a ribbon cutting, whatever they're doing, lots of places to do that. Then you're gonna get a crew together. And I see there's a question from Octavia. I'm gonna turn it over to you to ask that. I'm gonna go off camera, just blow my nose for a second. I have some allergies. But Octavia, do you want to ask your question while I do that?
Yes, I simple question asking if you could share that link to the location site in the chat or repeat it.
Sure. It's townhallproject.com. Townhallproject.com. Did anybody go to it to make sure it's still? Let me just go to it quickly myself. Maybe my Wi-Fi isn't working, but yeah, it's townhallproject.com. And
It still works.
it does? Okay, then it must just be my Wi-Fi. Okay, great. Yeah, that's the
Thank
site.
you.
Okay, sorry about that. Let me come back on video. So you can bird dog yourself if you want to. It's definitely easier with a crew. Particularly, it's always good to have someone holding a camera and someone else asking a question. And also, if you remembered when I talked earlier about putting stones on a scale, it's great if you have more stones, right? So we usually like go to a town hall with like 5 or 6 people. And that's usually a good number to bird dog. And it's also just like in terms of like safety and things like that, you'll just feel much more secure if you're there, with your friends or people who, feel strongly about the same things as you. And if you go with a crew, it's like, a fun thing to do. It's not like a chore. It's kind of like a little democracy mission you're going on. People usually have a pretty meaningful time doing that with a crew of folks. Make a plan. This is basically like, why you're there. I think it's easiest to talk about this in terms of what not to do, which I think is the next slide. Yeah. So obviously there's so much we can ask our senators about right now, right? We can talk about healthcare, which is why we're here. We could also talk about, immigration rights, workers' rights, minimum wage, climate justice, all sorts of things. So sometimes like 5 people will go to a town hall and they'll ask 5 different questions about different issues, right? That we find when we do this, that is a mistake. Because if you think about putting stones on a scale, what you did there is you put 1 pebble on 5 different scales, which probably isn't really going to affect anything. But if all 5 of you asked about healthcare, or particularly a specific healthcare bill, that's like 5 stones on 1 scale. And that's how you actually move things. And we found that like pretty much every member of Congress and every candidate has a staff member who counts how many times an issue comes up. So if like a bunch of different issues are coming up, they're not really going to be too concerned that they have to really change their talking points or change their strategy. But if like 10 people, ask about some climate resolution, then the staff is going to be like, hey, like what's our position on this resolution? Like everyone's talking about it. Like, what are we going to do about this? So we find if you get a crew together and like go to a town hall or go to like, a digital event or go to wherever you're bird dogging, it's great to just focus on one issue. And I know obviously everyone here is passionate about healthcare. Medicare for all, I don't think that's going to be passing anytime soon, but there are lots of other things we're trying to do right now. We're trying to protect people on Medicaid. We're trying to expand harm reduction funding to protect people who use drugs. We're trying to lower prescription drug prices in a variety of ways. So like focus on that issue, whatever it is you're passionate about, and just ask those, all those stones in one scale. So that's part of your plan. Showing up early is important. So in a town hall, it's good to just know the lay of the land when you walk in, because I think someone mentioned before that even if you go there, sometimes they don't want to hear from you. Like they're not going to call on you if you raise your hand. Even if there's a Q&A period, they just might not really field your question, which is true. And I'll tell you a funny story about that. I went to a Mayor Pete Buttigieg when he was running for president. I went to 2 of his town halls in the same day in New Hampshire. And he did this thing where he just passes around a hat and he writes down a question, you put it in the hat, and then a staffer like picks out questions and reads them. And it's supposed to be like totally random, right? Like it's totally random, democratic. You're just putting a question in, nothing is screened. So I went to 2 of his events in the same day, and it was the same exact questions, word for word, that were asked at both events, which we know is impossible if it's a hat of spontaneous questions. So it was just like a show, like it was just not real. Like they were just pre-written questions that he was answering. So that's an extreme example, but there are lots of examples of like, the Q&A period is great, but you might not get your question asked. So if you show up early and you're like, well, there's an exit over there, which is probably where he's going to walk out. So let's put some people by there. So as he's walking by, we can shake their hand, get a photo, ask a question. The entrance is probably over there, or like there's a rope line over here. Let's have people on the rope line where we can shake hands. So just like knowing the physical location and being creative about like, where can I interact with this person? Same with like, airports or parking lots, that kind of thing. All in like, a totally respectful civil way. Again, this is not like a sit-in or a protest, but you can get creative about where you're stationed to get a question. Raise your hand first, fast and high. This seems like a obvious and kind of silly instruction. But if you think about it, most people who go to a town hall just like casually, they're kind of just like sitting casually in their chair. Maybe they'll have a question, maybe they won't. We know we have questions, we pre-wrote them, we're ready to go. So as soon as you even get close to the Q&A period, just dart your hands up, sit up straight in your chair with a good posture, make yourself very visible. Again, this is a very simple instruction, but because we've talked about it, our folks get called on so frequently. We're sitting in the right spots, we're all, super visible. So if you do that, it does help get called on. Common mistake number 2, and again, this goes back to the stones on the scale. So another mistake some people do is, 6 people go to a town hall, they're trying to ask about, a healthcare bill. Someone raises their hand, they're called on, they tell a really, passionate personal story, they ask about the bill, and the representative gives a response, and it's a pretty constructive response. And so the other 5 people are like, great, like that's what we wanted. We got it on record. Let's just leave early, or let's just listen to these other questions and just sit here quietly, and then we can head home. Don't do that. Like keep raising your hand, keep asking questions, because all you did was you put 1 stone on the scale, right? And like we know that that's not enough to move anything. So even if you get a great, perfect bird dogging moment in, keep your hands up, keep asking the question, tell a different personal story, tell it in a different way. Make it very, very clear to them that lots of people are feeling this, lots of their constituents want to know about this, not just that one person. So don't stop, even if you get a great moment. Feel good about it, but keep going. Execute the plan, record on video and on paper. Again, you don't have to record, and I see some hands up. I'll get to y'all after this one slide. You don't have to record these things. You can just talk to your representatives if you want to, and some people might not be comfortable recording. But we tend to get as much of it as video as on video as we can. A lot of these clips are shared, or they go viral, or you can send it to an office after, or it's just good to watch how they react to certain things. So it's always good to record it if you can. Octavia, I think your hand might still be up from before, but Michael, did you want to jump in?
So I'm very concerned about with the town hall meetings with incumbents and candidates, especially incumbents, the moderate incumbents. I think I noticed that we're downscaling our fight. Not to say that Medicare goes on what it is, but I feel like we're downscaling the objective to go small. And I have issue with going small because when we go small every year and focus on other issues outside of Medicare for all, we're really basically taking our eyes off the prize, and then might forget about Medicare for all. And actually just this, I think what's a better solution or better strategy is a protest vote, or even doing like a sit-in protest at the town halls, because I'll guarantee you these politicians will keep re-electing them every 4 to like 8 years. They're not going to change. They're not going to do anything for us, because the problem is the special interest groups who have more priorities, who are actually being more prioritized than us. And so,
Yeah, I see what you're saying, Michael. When I said going for incremental things, I didn't mean at the expense of Medicare for all. We're doing all of the above. So the new Medicare for all bill will likely be introduced in May this summer, possibly June, May or June. So right now we're like meeting with offices, getting people to co-sponsor, getting people to sign up. And there's going to be another like big event when it's introduced again. We're still building as much momentum as we can to pass that bill. At the same time, like there are other crises right now. If y'all are familiar, the federal government gave state Medicaid programs emergency funding during COVID, and I've started withdrawing that funding. So lots of people are at risk of losing Medicaid right now. So we're like throwing down on the Medicaid front, trying to keep as many people on care as possible. There's like opportunities to lower prescription drug prices in a lot of ways. We had like an insulin win recently. Like we're trying to do that. Like we're pushing all levers, as we can. Healthcare Now, like this organization's conference, very focused on Medicare for all. But yeah, like we gotta protect people in all the ways that we can. So we definitely are fully going for Medicare for all. And yeah, like if you're part of a local organization, or if you want to join like CPD healthcare meetings, like we're definitely open to talking about doing those sorts of actions that you just described, those civil disobedience actions, when it's strategic. So thank you for suggesting that.
yeah,
I see Mike. I just want to make space for folks who haven't talked yet. I know Mike hasn't had a chance yet. Mike, do you want to ask a question?
Yeah, one trick we use in Oregon is that almost all of our federal and state legislators use a lottery system. So we gather as many people as we can, and each get a lottery ticket, and then we share them and try to get our best speaker to that ticket first. And I think it's best to sit close to each other so you can do that kind of maneuvering. So that's just one technique we can use out here in Oregon.
That's cool. I haven't heard of that. I don't think we have an affiliate out in Oregon, so I'm not too familiar with stuff over there, but thank you for sharing that. I think there's just a couple more slides here, so let's try to go through, and then we can do some practice as we wrap up. I kind of already mentioned this before, but don't feel contained to just a Q&A period. There's also like handshakes, autographs, selfies. During the last campaign, like pretty much every candidate had a selfie line, which is fun, but it's also a great opportunity to ask a question and do bird dogging. Another trick is sometimes folks will actually bring like the candidate's book and be like, hey, can you sign this book? And of course, they're all kind of have egos and they're kind of vain. So they're like, of course, I'll sign your book. And as they're signing, you have a solid like 20 seconds there to start a conversation and ask a question. So yeah, these are all pictures from interactions that we've had with candidates outside of the Q&A period, just chatting with them after. This part is something, sometimes I forget this, a lot of people forget this. If you're at a town hall or an event, there's bound to be some press in the room, local press, maybe national press. So go tell them, talk to them, tell them why you came out, what you're passionate about. They'll listen to you. Maybe they won't do anything about it, but sometimes they'll publish your story or talk about, what constituents are concerned about. So definitely go chat with the press if you're comfortable with that. And then, yeah, don't do any of this in a vacuum. It can be effective on your own, but it's great to do it on a team, talking to an organizer. I do these sorts of things. Other organizers at CPD do this. But now, like lots of organizations are doing bird dogging. Lots of people are very skilled in this all across the country. So like do it with an organizer and definitely report back, because if you have an interaction on a Monday with a candidate and we're going to talk to them on Wednesday, we want to know what they said Monday, right? So we can respond to it or like contradict it or, do some research. So definitely like keep a record of the conversations you have. This is the last big like piece of presentation, are what are the ingredients of a good bird dogging question? I kind of alluded to it earlier. They're basically two components of a good question, and maybe anybody have any ideas of what would make a really good bird dogging question? And no pressure, I can also just go through it, but I see Mike. Yeah, Mike, you want to suggest something?
One where there's no good answer for the candidate.
You say,
It's
what
sort
do you
of
mean by that? Do you mean like no room to evade? Is that what you mean?
Yeah, right. No room to evade. I'm sorry, that's a better way to say it.
Yeah, that was one of the two things I was looking for. So this would be an example of a bad question. If you ask them, hey, what are you going to do about the Medicaid problem? Or, hey, what are you going to do about the overdose crisis? That is a very vague question, and they're going to have talking points. There's lots of room to evade, right? They'll be like, oh, like, well, I sponsored this, and I care about my community, and I'm doing X, Y, Z, and none of it's going to be useful, right? But what Mike is getting at is if you asked a very much more specific question, like, hey, are you going to co-sponsor the Medicare for All bill or not? Or, hey, are you going to co-sponsor the CARE Act to combat overdose or not? Or are you going to support, like this $30 million investment in harm reduction or not? And like, they either have to say, yes, I'm going to do that, which is great, or no, I'm not going to do that. And then that gives us more information, or they'll be like, maybe I'll get back to you. And that starts a conversation. But ask that yes or no question, like put them on the spot to actually commit or not commit. Don't just say like, hey, I'm passionate about climate justice. I'm worried about my planet. Like, how are you going to protect me? Because they'll have an answer for it and it won't really be that helpful. So yeah, that was great. Thank you, Mike, for saying that. And this will be on the next slide, so you don't have to jot down notes yet. But the next part of it, oh, sorry, Michael, did you want to say the other part of good question?
Well,
Maybe.
yes, but we're going to agree to a good question, right? So I was thinking like, I'm gonna think, so let's say like the incumbents are not willing to co-sponsor Medicare for all, or they say that they'll get back to us. What
Mhm.
will be a good time to like boycott these incumbents and find someone running against them, but also get something done with big bold policies? Because we already know like these incumbents in the current Congress and Senate, they really don't care, and they keep using the same talking points again and again. So how do we come up with alternative talking points to really like catch them in the act?
Well, in terms of, I think one thing you raised was in terms of getting new candidates, that would be like a larger kind of electoral discussion, which is not quite what we're talking about right now. But in terms of what you said, in terms of like, asking a question that they can't ignore, which is another way of saying what you said. And that is kind of the other part of the question of, sorry, the two things that are a good question is that you start with something personal about you. So I think I said earlier that everyone here is an expert on your own story. So when we went down to like, save the ACA, we didn't go with like graphs and charts and like statistics. We just went with like, hey, like I need this medication to survive. I can't afford it without the ACA. Like I'm gonna die if you like if you don't, save this bill. And like that's the story. Like that's something they can't really ignore. I mean, they could, and some of them do, but it's certainly harder to ignore. And even in that case, we got Republicans to protect it. I know there are 3 bullets here, that there should just be 2. But yeah, so the first thing is you tell a personal story about yourself. And the second thing is what Mike said, is you make a very specific ask. I think I have an example on the next slide. Okay, a couple examples, but let me do one example first. So this is my healthcare example, which is the story I told when I went to protect the ACA. Is basically the same story I tell when I do like healthcare bird dogging, which is, I wouldn't exactly say this word for word, but the gist of it is, my name is Vinay. I live with like several mental illnesses that are pretty severe, and I need like expensive medication and often therapy to survive. If I don't have those meds, I'm a danger to myself. I've like survived a suicide attempt before at the start of COVID. I'm worried like if I lose employment, I won't be able to get access to these medications anymore. And lots of people like me are in this situation. So you, Senator, like, are you going to, co-sponsor Medicare for all? So like people like me, like have security that we can have access to our medications. And that's it. Like it took me like what, 30 seconds to say that. That's all it is. Like I have a personal story, like, are you going to support this bill? And that's basically it. And this previous slide has a couple of different examples, because you can do this for all sorts of issues, right? So let's say you're at the state level. Actually forgot what I put here, but yeah, personal story plus will you commit to authorize overdose prevention centers? I don't know if folks are familiar with those, but those are centers where you can use drugs safely. They reduce overdoses. So that could be like, I lost a family member to overdose. If they had a safe place to use drugs, they'd still be with me. So Governor Hochul in New York, like, will you support investing and legalizing overdose prevention centers? That's just one example. I don't think I need to read through all of these. But yeah, it works at every level, state, local, national. You tell your personal story and you like give that ask. And if you have like dozens of people like telling these stories, healthcare stories over and over again, it is very hard to ignore. That is how we saved the ACA. That's how we got investments in harm reduction. We got, Medicare, the power to lose to negotiate lower drug prices. Like all these recent healthcare wins we've had are basically based on the same model of bringing people to their legislators with these questions. And Octavia, did you want to have a question or comment on that?
Yes. Can the personal story be interchangeable with the personal stories of the people you represent? For instance, if you are attending this meeting as a representative or an organization that is advocating for a particular population.
Yes, absolutely. I'm glad you asked that because like obviously the story I just shared was pretty personal, right? There's no like obligation for anyone to like, you don't have to bury your soul if you don't feel comfortable. Like we're not asking anyone to do that. It can be very effective when you do, but you can also, me as an organizer, I can, speak for, my organization, made up of these people, like with these concerns, here are some of their names, here are some of their stories. It doesn't have to be about yourself. If you're from an organization or you're from a locality, like people in my state, XYZ are suffering this, people in my city. Does that answer your question? I think I answered your question.
Yes, thank you.
And I think I had one other similar comment I'm forgetting. But yeah, if you're comfortable telling your story, that's great. If you're not, you can tell family member story, friend's story, with their consent, of course, or people in your city, people in your organization, whoever you're representing. Jim, I don't think you've spoken yet. Jim, do you want to jump in?
Yeah, early on, somebody mentioned being challenged to sort of confront somebody they know personally. And that dynamic exists very much in the labor movement, which I'm trying to engage with, in that labor unions typically engage with their politicians on a wide range of issues. And they don't want to piss them off on one issue by going after them too hard. And just wondered if you could comment on that.
Yeah, that's a good point. Particularly the more local you get, I guess becomes more and more of an issue. I think like when we've done that, I guess I don't think it's like everyone's responsibility to talk about every issue. Like if there's, like it may not be you, maybe someone else who like doesn't have that relationship or may be able to make that ask without it being, controversial or dramatic. But part of it, I don't know, part of it is kind of like compartmentalizing, different relationships. And while we're in this arena, we can talk about these things, and that doesn't affect what we talk about in other arenas. But yeah, on that level, I guess it does kind of get tricky. I don't know if I have a immediate answer to that question. But I will think about getting a better answer for you on that. Hopefully by the end of the period, but if not, maybe later. Madi, did you want to ask something?
Yeah, absolutely. I have an answer for that. I live in a very red county, and I have a lot of friends who are really conservative. And we've been learning how to do deep values canvassing. And if anything, it's an advantage to these people personally, because then you can have ongoing conversations with them using those techniques. And it's really effective to listen to people and ask them questions about why they believe what they believe, and to give them examples in your life about why you believe what you believe. So I actually think that if you know someone personally, it's an advantage.
Yeah, absolutely. It certainly can be. I understand it being an advantage and also a concern in terms of its relationship. It's going to extend beyond one conversation. So I want to make sure you keep that bridge going. Yeah, I guess it's not totally the focus of this presentation, but I should, think through that a little bit more for future presentations. Have a better answer to that. So that was the presentation, and it's about 2 o'clock right now. So, how about, in the past, when we've done this, we've done like a practice at the end where I'll pretend to be a senator who is, kind of a centrist Democrat, not quite committed to Medicare for all yet, but maybe I'm open to getting there. And we can pretend like we're at a town hall and I can just call on folks and you'll like bird dog me as that senator and try to convince me. Does that sound like fun? Is that something people want to do? We don't have to do it, but it's usually fun for folks. Yeah. Okay. So at 2 o'clock, maybe let's take like a 5-minute break and we'll come back at 2:05 and just use those 5 minutes to think like, all right, do I have a personal story I want to share? If I don't want to share one, like just like my, communities, my city, do my family. Just think through a story you might want to tell. And like, remember, when you raise your hand, you want to start with something personal and then ask something very specific. So don't ask me like, hey, how are you going to improve healthcare? Like, don't do that because I'll give you a really bad answer. But take 5 minutes, think through how you might want to approach this. And at 2:05, I'll come back in character. So I'm not going to be super nice. I'll be in character trying to avoid your questions. And we'll do that.
Coat tie?
When I do this in person, I usually do bring a blazer with me. I forgot to do that for this. I should do that next time. But yeah, I'll come back in character. We'll do it, just for a couple of questions as long as we feel comfortable, no pressure if you don't want to participate. And then we can kind of wrap up. It seems like we won't take the full time here, so you'll get some time before your next session. But yeah, I'll see you in 5 minutes, everybody. Grab some water, go to the bathroom if you need. All right. Well, thanks everyone for coming out today. I got a tea time with the district attorney. I'm gonna head over, play some golf. I guess I have time for a couple of questions, a few questions. Anybody want to jump in? Anybody got any questions?
It
Michael?
looks like Michael's hands.
Yeah. Michael, do you want to ask a question?
Yeah, I do
I
want
don't
to ask. Yeah, I do want to ask a question. It's going to tie to a personal story that you mentioned earlier. So so the question I want to ask is this. So although universal health care is going to benefit, although although universal health care Medicare for is going to benefit everybody at the national and state level. But in the meantime, how do we fight for tangible policies for specific populations, especially Black American descendants of slavery? They need reparations in addition to Medicare for all, because they fought for this country for 400 years and counting, and they never got a chance to build intergenerational wealth. Building intergenerational wealth is restoring health. Without restoring health, you don't have intergenerational wealth moving forward. And they're not waiting to start small, because they've been fighting for 400 years and counting. Thank you.
Yeah, thank you for that question, Michael. I think, as you know, all throughout my campaign, I made healthcare, a priority for myself. We're working, throughout the state, really, to expand Medicaid, to make sure people can afford the ACA. We're doing everything we can to keep folks on healthcare, keep them safe, keep them getting the medications they need. I think I've made that clear, but I'm happy, to hear your question. Happy to talk more about it offline. I do have to get going soon, but maybe I'll take a couple more questions. Let's see here. Greg, did you want to jump in? I don't know why I know your name in this context, but Greg, do you want to jump in?
Yeah, I have a friend that's retired, living on a limited fixed income. He's a diabetic, and he suddenly found that his insulin was going to go up from $100 to $500 a vial, and he can't afford that. And there is a bill right now that's that you can support that would alleviate that problem, where he could he would not have to pay anything out of pocket when he gets his medication, and that would solve a problem. It's HR 1976, and I want to ask if you will support that bill so that people like my friend do not have to get, think twice about getting their medication when they're sick.
Thank you for that question, Greg. Wow, that's really sad to hear. No one should have to pay that much for any drug, definitely not insulin. I'm actually not familiar with that bill myself. I think I'll flag that for my staffer, make sure we talk about that, get back to you as soon as we can. Maybe I'll just make sure we get a business card over to you so we can talk a bit about that. Thank you for sharing that story.
Thank you.
Margie, did you want to jump in?
Yes. Okay. In my last years of my mother's life, she spent a great deal of time in adult care homes, which is a form of long-term care. And I saw her go through almost $500,000. And I noticed that most of the people that were caring for her were African Americans, Latinx, and immigrants. And I was curious to see how much these type of jobs would pay. So I went to the Labor Department's website and was shocked at how low the pay was. And I felt that this was unfair. How do they support their own families? And what really bothered me was that when they become old, they're not going to be able to afford the kind of care they were giving my mother. So I became convinced that the only way to finance long-term care is publicly. And so I became a supporter of Medicare for all. And I'd like to know why you have not co-sponsored the bill in the House.
Thank you for sharing that story, Margie. I definitely share your concerns. Again, I think I made healthcare a priority during my campaign. I want anyone who can get healthcare to get it. We've been talking, I've been working to, lower the age for Medicare, which I think would help the problem you described. I'm not quite there on Medicare for all yet, to be honest. I feel like I'm not sure, is it feasible? Is this something we can pass? Is it something we can pay for? I'm open to the idea. I certainly, I agree with you that everyone should be covered if they can. Right now I'm focused on, expanding Medicare, expanding the ACA. That's kind of how my office has approached it. I know some other senators are taking different approaches, but yeah, thank you. Thank you for your story, Margie. And thank you for telling that story. Dave, did you want to jump in?
Yes, Congressman, I've been to a couple of your town halls before and asked you questions about why you didn't want to support Medicare for all, and I assume you still are not supporting. In the context of answering those questions, you've always come up with, well, I support a public option, and in particular Medicare X or Medicare Extra, and you told me I should look at that plan and look at the benefits there. And I've looked at it and it just doesn't stack up. And I wondered why, if you support that, why you and your colleagues that are also on that page have not been pushing for that plan actively, and have just kind of sat back, just like President Biden did. He campaigned on a public option and he sat back and did nothing. So I wondered what is your response to that when we know that Medicare for all would be a better plan?
Thank you for your question, Dave. Good to see you again. I feel like we just keep doing this every week at our town halls. Thank you for looking into Medicare X. I know it's not quite ideal, but we are trying to improve it. The version that we have right now is just the first iteration. We're going to try to improve it next year, expand funding, make it more accessible for folks. I hear you. It seems like a lot of folks here today are passionate about these issues and about Medicare for all. I wouldn't want to take, choice away from folks who really love their providers, love their doctors, folks who like their insurance and don't quite want a public option for themselves. So I want as many people to be covered as possible. But thank you. I see that, Dave. Thank you. But we're going to try to keep as many options as open as possible instead of one. But I hear you. I think a lot of people here are passionate about this, so maybe I need to huddle with my staff about this a little longer. Maybe I have time for one or two more questions. Anybody else want to ask anything?
I have my hand up.
Yeah. Go for it.
I was a country physician for 30 years and finally threw in the towel because the system did not allow me to take care of my patients who were dying from treatable disease and suffering because they couldn't get adequate treatment, even though I knew what needed to be done. The problem with public options is that the basic purpose of our healthcare system is to make money, and by doing that, they deny care. And the only solution to that doesn't do that is Medicare for all. So the public option doesn't do that. It costs more. The private companies cherry pick and lemon drop. So I would like to know, given all the data, why you are not supporting improved Medicare for all.
Well, listen, Marty, it seems like you and a lot of your constituents are very passionate about this. So you know what? I think I'm going to huddle with my healthcare staff and see if we can maybe work towards actually supporting Medicare for all. It seems like maybe that is the best solution. All right. Thank you, everyone. That isn't how your town halls are going to end, by the way. I'm sorry. That's not how they're going to end. But maybe months down the line, they might. I fast forwarded through a lot there. But yeah, I got to note that we only had 5 minutes left. I thought we had longer, so I thought we should wrap. But was that fun for folks? Did people feel a little bit more comfortable about doing this sort of thing? It's actually not that different from what you just did. And a lot of you asked really great questions. Margie, your question was really great. I wasn't sure where your story was going. And then you got it. You tied it up really nicely. That was a really great story you told. And I mean, I shouldn't say great story. All these powerful stories are stories we wish we don't have to tell, right? So it's always a good trade-off there. But yeah, y'all did really great. Thank you for jumping in. Thank you for asking questions. And I hope you're a little bit more comfortable after this. Obviously, this is just one session. I'll try to make sure you all get this PowerPoint. I also dropped my email in the chat. So feel free to ask, continue the conversation, ask any questions there. But yeah, if you forget everything else I said, which you might because it's a Sunday afternoon, but remember that, like, you're an expert on your own personal story. Like, that's all you need to do this. So hopefully you feel a little bit more comfortable doing it, and it's definitely gotten us some huge wins in the past, and I know it will in the future. So yeah, thank you all. Good luck. I hope you all have a great conference and keep doing your work. Thank you so much for doing this work.